Good afternoon, everyone. I welcome you all on behalf of Mercer Marsh Benefits to our webinar today, which is themed around health on demand report, delivering the employee benefits now. I request my colleague to put up the deck. Yeah, thank you so much. So warm welcome to everyone. We are at 4.32 and we have more than 50 audience already joining us. So I welcome all of you and also my colleagues from different parts of the world to this webinar. Just on a quick note, we will go live in terms of running the session in next few minutes. And I welcome all of you to keep posting us questions through the question and answer tab. And we'll attend all those questions after we finish presenting the survey report. This webinar themed India Health on Demand Report 2021, delivering the benefits employees want now, is a global event, and we are releasing the India version of the Health on Demand report today in India. I have with me my colleagues, Dr. Nimita Menon. Dr. Nimita Menon heads Health Risk Consulting business for Mercer Marsh Benefits in India. I am myself Prabal Kalita. I lead the Employee Health and Benefit business for Marsh in India, and I'm MB leader for India. I have also with me my two other colleagues from US and Canada. Nicole, who's based out of US. Nicole is part of our MMB advisory and solutions, and she's part of our global team. We also have with us Amy Lavrock. Amy is the global leader for MMB advisory and solutions. Amy has in her earlier avatar visited India as many times and have worked very closely with all of us and carries therefore immense experience of the entire APAC region and also in India. Moving on from here. In terms of agenda that we'd love to spend time with you in next 1 hour, we'll cover broadly 3 agendas today. First of all, this global health on demand report is something that we do every year. So this would be, I think, the 3rd year when we'll be releasing this report. And this entire report is structured around 2 parts. One is what employers are offering today in the health and benefit space, especially given that in the pandemic, post-pandemic era, it's very important for us to revisit what is our strategy on the healthcare side. So we'll talk about how employers are making a difference to their investment post-pandemic, especially, and during the pandemic also in the healthcare area. Second, we'll look to the workforce voice on what is it that our workforce is demanding from us. I think the difference between all the earlier surveys that we have done on this subject and this year is that this year we are looking at hearing the employees' voice more closely, and therefore you'll find through the entire discussion here more focus on what is it that workforce are looking at, what is it that our employees are looking at in the healthcare space. And we'll present you the India version of this report, as well as also throw light around the global versions of this report. And lastly, how therefore, given the fact that how employers are, what is it that employers are doing, and also given what employees are looking to hear from us, how do we collectively see the overall benefit journey in India evolving, and what is it that together we need to do more for a very engaged workforce. So these are the 3 agendas we'll visit today through our discussion of next 1 hour. Moving on from there, I think when it comes to what is it that employers are looking at in terms of healthcare strategy. So we have done many other surveys in the recent past, especially through the pandemic times, and we have got many perspectives from the employers on the table. One of the very important perspectives that we have heard is 1 out of every 2 corporates in India is looking at how to reallocate or optimize my benefit budget. So if today we are spending $100, how do we want to optimize this, and how do we want to invest more dollars in overall healthcare and benefit journey for our employees? Second thing that has always stood out was the fact that flexible benefits is gaining more and more ground. I think from an earlier report that where we had seen more than 54% of the organization getting ready to introduce flex benefits, I think that number has now accentuated to 84%. So overall, India Inc. is looking at offering flexibility in their benefits, and flex benefit as an area of work is therefore getting more and more prominence. Thirdly, 47% of the employers in India are looking at doing more work in the mental health care piece. In fact, 47% was the number pre-pandemic, and now in this new report that we have got, it indicates almost as high as 74% of the companies are looking at even digital healthcare as one more area of work. Lastly, environmental, social, and governance are the key themes, and this is one strategy which most investors are looking at when they today invest in different parts of the businesses. So as an ESG investor, what is it that they're looking at is how overall our focus on healthcare is, how does the healthcare impact our supply chain, our environment, and customer experience and brand. I think this is one more area of work that Dr. Nimita, Nicole, and Amy together will spend more time today. Moving on from there, I think largely this you'll find through different parts of the conversation today is that when it comes to supporting our employees and their families in moments that matter, that is what is truly being valued a lot by our workforce. Secondly, investing in mental health care is also being immensely valued. Thirdly, delivering benefits equitably is another area that most of the workforce today are looking at as a response from their employers. Fourth, we already spoke about how overall digital healthcare has gained prominence in India. I think enabling digital access to healthcare is becoming more and more important, and we do see at Mercer Marsh Benefits more and more companies investing in this area. Fifth is the providing a varied and valued benefits to all our employees and their families. I think when we talk about a multi-generational workforce being there across India today, we do understand therefore that workforce is demanding a very varying benefits to be provided and very, very valued benefits to be provided. So I think overall, if I have to look at 5 areas where employers who are showing that they are ready to invest is what is being valued the most by our employees. And we'll spend considerable time in this to discuss further. Overall, if I look at it and summarize, this is what we have been advocating globally. Health and resilience of our people would mean health and resilience of our business. And that's something most organizations today are learning and embracing as much more, because we know that as and when our employees are healthy, our workforce is healthy, that's when our overall business would be healthy and business would be resilient. With these 2 thoughts, I'll leave the floor open to Dr. Nimita. But before I do that, a quick perspective about the Health on Demand survey that we have done this year. We have got survey form filled through overall, over more than 14,000 employees have filled out the survey globally. And we have collectively, gathered the intelligence from all these surveys to present you the report today. So over to Dr. Nimita from here, who will roll out the survey further. Thank you so much, everyone.
Thank you so much, Praval, and a very good evening to everybody who have joined in this call today. I would start definitely on your screen. You can see support the moments that matter. And this is definitely a close to heart topic as well, because it's not just, your employees, all of us have gone through those, that 360-degree change when it comes to the pandemic and the moments that matter, how we have redefined it. So while the pandemic in itself has been an overwhelming and a surreal life event for all of us, it has definitely redefined the overall individual outlook towards life, I would say, as well as broadened the spectrum of moments that matter. So our study clearly demonstrates the fact, as you can see from the graph here, the fact that the pandemic affected employees differently. And the good news is that it was all not negative at all. We had over a quarter of employees actually voicing out the fact that they had a positive impact that the pandemic have had on them. And a similar percentage, I would say, close to 27% mentioning that they have had a negative experience. Again, the good news is that we have a good half of the employee population talking about the fact that they have a mixed feeling of positive as well as a negative experience. So in total, if you look at it, the pandemic and the shutdowns, while right now when we look at it, yes, we all were super resilient during the times and we have come out successfully out of it. The experience was definitely not purely negative. We had a lot of positive outcomes or experiences coming out of it. So it is very, very critical that we have a better understanding of what has been defined by your employees as positive and negative experiences, since that will literally help you, or that those are going to be the opportunities that we have to identify the defining moments and thereby providing appropriate support. So let's have a quick look at those 5 negative experiences and positive experiences, because I'll definitely bring this back in our later conversation as well on how do we integrate when we are predefining our benefits. So we talk about the positive experiences first and not the negative ones. So from the top 5 experiences, what employees voiced out is that increased time at home is definitely being valued by employees, started new activities and hobbies. So we can definitely see the shift of social well-being and the socialization part of it coming into the overall spectrum. Better work-life balance or experience is what employees are talking about. I need less materially to be happy. I think that's a big one, because people have started, again, I would say, looking at it from the fact that we really do not need too many materialistic things to be happy in life. Enjoyed no commute due to remote working. For all those who have joined from Bangalore, I'm sure that you will be able to relate to this. And in fact, one of my points of positive experience as well is the no commute, which is giving me enough and ample time for me to basically divert myself to certain other things, which will be a positive experience for me. From a negative experience, we need to have a look at that as well, because as I said, this also becomes an opportunity for us. Financially worse off, I think that most of us are pretty much aware of this, because we have seen employers coming up with financial options in supporting the employees during the pandemic stage. Lonelier and more isolated, we will touch upon in details in the coming section where my colleague will talk about it. Less healthy and physically fit, no surprise here again. Experienced a mental health issue, and work is less satisfying. So these were the key callouts that we had from a positive and negative experiences. And moving on to the next slide from here to talk more about the moments that matter. Before that, let's have a quick look at, a poll question, and we would definitely like all of you to, rate yourself here. So how would you rate the support your organization has provided to the employees during the pandemic? Would you say it was poor, fair, acceptable, good, or very good? We will just take a few more seconds before we end the poll. Wonderful. Awesome. So great. So we see that we hear from you that 55% of you feel that you had provided very good support, 30% of you good support, and 15% of you acceptable support. I think the result is out, and it is definitely a big shout out for all of you, because even from our survey, it is a winning moment for India, because India results was much better than even global, with 60% of employees reporting good and very good support from the employers. The given scores is also higher than China, which was at 57%. If you look at rest of the APAC, Indonesia, which was at 52%, and even Singapore, which had a 44% response from employees, wherein they mentioned that the employers provided very good support from employees. So kudos to India and the HR fraternity, because definitely that 55% of you and rest of you who mentioned about good and acceptable support, believe me, there has been a huge recognition even from your employees that the employers were providing a great support during the pandemic. So while the employee support has been rated at the highest, they also recognize the support received from their healthcare professional, government, as well as private medical insurer. So even before I jump into the next slide, that the employer support matters, definitely the support provided by employers during the pandemic has a direct bearing on employee well-being and loyalty. At the same time, let me also call out that flexible working is what we have seen grown in popularity and is one of the most desirable benefits according to our survey respondents. So in this slide, as we touched upon in the earlier section, ultimately, and Praval mentioned about it, we are striving to attain health and resilience of business by supporting employees to be healthy and resilient. So does the support provided to employees make any meaningful difference to employees is always a question or a point that we end up discussing. So the results again are out. Yes, the pandemic has served as a major example, and now we hear it very, very loud and clear from the employees that employers that provide meaningful support, let me again mention the word meaningful support to all the employees are helping to create a more resilient and loyal workforce. So as you can see in this slide, just look at the percentages which are mentioned in blue vis-a-vis the ones which are mentioned in red of employees who reported receiving good or very good support during the pandemic. We had 62%, that's the number in blue, feel their employer definitely cares about their health and well-being, which is almost double the number. That's the 30% that you have. Who are employees who did not receive much support from their employers. So meaningful support by employer also had, that's the next two graphs that you have here, had an impact on retention and employee engagement and also resilience. So in case where the employer support was available, you can see that 36% employees are less likely to leave their job, thereby retention, and 87% reported feeling energized at work, at compared to 66%, where the delta is pretty huge without any employer support. So you are basically also helping them to be engaged at work when you are providing support to your employees. So employees who felt supported during the pandemic felt more cared for, which made them significantly more energized, as you can see here, and less likely to want to leave their job. So employers definitely need to have a broader view of the moments that matter to individuals. So let's look at what do we mean by moments that matter in the next slide. Great. Thank you, Shilpa. So while providing relevant or a meaningful benefit is key, the core, as you can see here, is flexibility and choice. So flexible working was seen as a most important well-being benefit. Out of 3 of 5 employees, roughly around 65%, would highly or extremely value this benefit, about which we will talk in the coming section. My colleague Nicole will be taking you through the details of the flexible working that we are talking about. So let's quickly look at the moments that matter and what we have mentioned here. So supporting employees with significant life events, such as living through a pandemic, which we did brilliantly, loss of a near and dear ones, or life events like a marriage, childbirth. There are many, many opportunities to support them in the moments that matter. So employers can help employees accomplish their life goals, such as spending time with family vacation, socializing. And this is the point where I would want to draw your attention back to our first slide, where we spoke about the positive experiences and the negative experiences, and how you can translate them into moments and matter and integrate into the benefits or the policies that you want to create or define for your employees. So things like taking out time for family vacation, observing certain daily rituals, be it exercising on a regular basis, or even pursuing my hobbies, because one of the positive experiences they have mentioned is about taking out time for my hobbies. So the opportunities are in abundance. We definitely need to figure out the moments that matter and define your benefits accordingly. So while globally, as you can see here, while we could group them into a COVID crisis, recovery, one another point that we really definitely want to bring it to light is how do we translate with few examples, few of the things, how the spectrum has broadened in an India context. So let's quickly look at how it translates to India context, right? We all know, and as a matter of fact, elderly care or the parental cover has always been a point of discussion and a highly valued benefit. And come pandemic, it is not just about the elder care. We have seen that spectrum to be broadened to have provisions for access to ongoing care, which is being provided for elderly. So there is emergence, we do see emergence of caregiver requirement in Indian scenario. So caregiving, it is just not limited to elder care, but it also extends to having an ailing family member, which has a huge impact on your physical, mental, as well as social well-being. So basically, organizations should support employees in achieving better work-life balance by embracing a wider definition of flexible working. So this means giving people more choices, not just about where they work, but we also need to look at when, how, and the accompanying benefits that we can provide to support them in their moments that matter. The slide which you have here, I will just quickly walk you through this. So undoubtedly, we see that there is a huge relevance of the benefit provision, and it has a very high impact on the employee experience. One another key call out is, so does the number of benefits that you are going to offer. So as we can clearly see here, the higher the number of benefits that we offer, higher percentage of employees reporting the experience to be mostly entirely positive. So to share further insights on this and the details, I would like to invite my colleague Nicole to share insights on the valued benefits that we have in the next section. Over to you, Nicole. Thank you so much.
Thanks, Namita. I'm excited to discuss my personal favorite finding of our research with you all today about providing varied and valued benefits. So if we go to, so on this slide here, you can see that employers who support their employees with health and well-being resources, such as medical and life coverages, among other offerings, not only have more optimistic employees with stronger mental and emotional well-being, but they also have employees who are more loyal and productive. Employees who received more than 10 health and well-being resources from their employer reported they felt less likely to leave their job, more cared for, more energized, and more confident they could receive the health care their families needed, compared to those who only received 1 to 5 benefits from their employer. So if we go to the next slide, what benefits could employers bring to their workforce? Well, they can always expand lines of coverage or coverage eligibilities. In addition to that, though, benefits that employees only get to experience once an emergency happens, such as accident insurance, don't have the same visibility as something they get to experience more frequently, such as a healthy work environment or financial planning support. That's why it's so essential to offer a mix of resources and solutions. 62%, or almost 2/3 of employees in India, would like to customize their benefits to meet their needs. For example, if an employee's parent needs healthcare treatments, the ability to arrange that would be seen as incredibly valuable by the employee, but requires a plan that allows for parental coverages. On the next slide, we can see that though there are some benefits that are desired by most people, others are valued intensely by just a small portion of employees. For example, people living alone are more likely to be struggling with feelings of loneliness and isolation. Facilitating social support structures could be very important for these individuals. Offering a broad range of supports makes it more likely you will offer something for everyone. Employers should be careful not to rule out benefits that are highly valued by only a minority of their workforce, as they can add significant value by adding depth and breadth to the organization's offerings. So then when thinking about the types of solutions to offer employees, it is important to remember that employees want digital solutions to find and access healthcare and to self-manage conditions, which if we go to the next slide is our third section, our third finding on enabling digital access to healthcare. And diving into digital, when we think digital, we're thinking, I know something that can come to mind immediately is telemedicine and virtual care solutions. These solutions were utilized at rates that were never seen before the pandemic, during the pandemic. We expect that these solutions are here to stay. 81% of the employees in India who used telemedicines and other digital solutions during the pandemic intend to keep using these solutions in the future. And even among those in India who used telemedicine for the first time during the pandemic, 3/4 intend to keep using the services. Given this, employers should consider auditing their benefits programs to ensure they include a variety of digital health solutions beyond telemedicine, beyond and including telemedicine. So if we go to the next slide, digital solutions make finding and accessing healthcare more convenient, discreet, and affordable. Employees in India are interested in having more flexibility and control over their healthcare, with approximately 2/3 of employees highly or extremely valuing COVID-19 tracing apps, home testing solutions, and apps that help self-manage health conditions. Employers can leverage well-being apps to automatically flag existing tools and offerings that might be relevant to individual employees. There are new innovations that can also nudge people to stick to health routines they have set themselves, or even remind them to take medication via smart pill bottles. And you can see here a number of the results of the percent of employees that rated the solution either highly or extremely valuable. So we're talking about the percent that rated these solutions a 6 or a 7 on a scale of 1 to 7. And some other findings of interest, as I mentioned, the top 3 are all rated highly or extremely valuable by more than 60% of equal to or more than 60% of the employee population, which is very interesting. But also you can see that close to 60%, 57% were looking highly or found apps and devices to help manage self-manage health conditions highly or extremely valuable. Virtual and augmented reality solutions to provide self-care was also a very highly valued solution. And then, health solutions of the future were also of interest and of value, such as tests that use my genetic makeup to offer lifestyle suggestions and further screenings. So yes, if we go to the next slide, you can see kind of our next poll question. Now, this isn't really a poll, it's more of a pop quiz, as the employer has an important role in enabling digital access to healthcare. So let's take this quiz of sorts to based on our research findings. So in which country do people trust their employer the most to deliver high quality, convenient, affordable, and secure personal health solutions? So we'll give you a minute to answer this, or we keep going here. Okay, so all right, well, if you guessed India, you are correct. India was the highest, with 65% of people reporting that they trusted their employer to deliver high quality, convenient, affordable, and secure personal health solutions. So if we go to the next slide, we're going to dive into this a little more. And so benefits plans are evolving to recognize that healthcare is no longer confined to inpatient and outpatient settings, but can now be delivered virtually anywhere via self-management tools and devices. And the employer can help facilitate this virtual connection. Introducing digital health and well-being apps into your employee benefits plan can also align with environmental, social, and governance goals by making healthcare more affordable and accessible. And given the state of climate change around the world, digital healthcare solutions have the potential to serve as a vital connection point between individuals and providers in times of natural disasters and unexpected weather. Digital solutions via mobile devices also enable employers to provide access for more employees who do not have a home computer. We're going to be talking more about the power of digital access to healthcare in our next section, focused specifically on mental health, which will be covered by my colleague, Amy. So over to you, Amy.
Great. Thanks so much, Nicole. It's a real pleasure to be here today. As Nicole mentioned, digital virtual care is going to be key in providing the fourth thing that employees want from their employers, and that is a clear commitment to supporting mental health. This is a top concern of employees today. I'm sure that's no surprise to all of you. It came through loud and clear in the research, the Health on Demand research as well. And if you think about it, emotional well-being is just such a critical part of our overall well-being. For me, just like physical health and financial health and social health, I have to actually really work at my emotional well-being and be very intentional to keep it strong. So caring employers really support people on prevention and treatment, and also create cultures where mental health can strive. So we're working with a lot of organizations right now to create comprehensive mental health strategies that cover prevention, treatment, support at work, as well as support away from work. So our call to action is to invest in mental health. And you can see on this slide that India came in second in the level of stress reported by employees, just behind Mexico. 3 in 5 employees in India, 59%, report feeling stressed in everyday life. That is a higher level than both the global and Asia region averages. 1 in 6 actually feel lonelier and more isolated, and 1 in 4 say they are financially worse off than last year. So while COVID was undoubtedly a major factor, it really just accelerated trends that were already in place, and exposed issues, I think, with people not being able to speak openly about their challenges. 75% of employees in India reported that they were not fully comfortable talking about mental health challenges with family, with friends, or healthcare professionals. And so while I think there's a lot of complicating driving factors around this, some of which are out of the employer's control, there are many, many supports that employers can provide, which brings us to the next slide. So given that, if we go to the next slide, please, Shilpa, given that improving access to affordable mental health care is an urgent priority, the good news on this slide is that many employees would welcome mental health solutions. Employee assistance plans, EAPs, they're a safety net. In India, we saw many of you add this important, very foundational level of support during the pandemic. So well done. And I think progressive employers are looking to offer even more diverse support. And this slide gives you an idea of some of the things that people really value in India. Reducing the cost of mental health services is critically valuable. I know in India, we've seen better outpatient coverage, better inpatient coverage in the last couple of years, partially driven by legislative changes. But there's still, poor use of these for just general depression, anxiety, for example. And of course, as we know, access remains an issue. So according to the World Health Organization, there's only 0.3 psychiatrists per 100,000 people in India. That number is 27 in Germany, 18 in the UK, 11 in the US, and 4 in Singapore. So, I think there's services that use digital means, that use peer support. They'll help. They won't solve the entire problem, but they'll help extend that critically, that role of the human counselor, the human health health professional to help fill in some of the gaps and just extend that human delivered care. In addition, some of the more specialty targeted focused solutions like resilience building on the preventative side, youth specific programs, which we're starting to see in some other geographies, offer the potential to be more efficient and effective. One last point on this slide, I can't emphasize enough how important programs are to make mental health something that's okay to talk about and get help for. Tools that provide training on how to identify and support others facing mental health challenges was highly or extremely valued by 59% of the Indian workforce. So a real opportunity there to help with skill building. Okay, if we go to the next slide, this is all about social health. So social health is another pillar of well-being. Namita talked about some of the silver linings of the pandemic. And I think, individuals and organizations really learned, certainly I did, the critical importance of social health. That's the ability of individuals to form healthy, rewarding, interpersonal relationships with others. And that ability to be kind of engaged with others in your community, to develop and maintain friendships, having that supportive network of family and friends to help get through life's challenges is just so important. And many of us, historically have satisfied this need from our colleagues in the workplace. So going forward, employers are going to need to be much more intentional around how they design workspaces, virtual communities, events, and so on to foster this very important form of employer facilitated support. So you can see on this slide in India, 55% would highly value employer-based social programs used to help minorities and allies meet and share their experiences. 55% would highly value communal spaces at work sites for innovating and socializing. 57% would highly value employer-based digital or social platforms to support social engagement. And 59% would highly value virtual support groups for those who are feeling lonely or isolated. So if we go to the next slide, think about how your organization can invest in mental health, making really deliberate moves to help people enhance their mental health and create emotionally healthy workplaces has real business value, as you can see from this slide. Employers that provide mental health and counseling benefits create a much stronger social bond and engender greater loyalty from their employees. So of employees who have access to mental health benefits through their employer, 74% report feeling well supported versus 56% without access, and 40% are less likely to leave the company versus 29% of those without access. So I'd also just add mental health benefits can reduce a number of risks, business risks involving safety, misconduct, productivity, and reputation. So, think about how mental health impacts your overall business resilience, productivity, engagement. That should help strengthen the business case for further investment. Quickly addressed any of those known mental health stigmas in the culture through leadership, communication, and manager training. We're helping a lot of organizations train their executives on mental health, the physiological impact of pressure and stress, and how to enhance leadership and supervisory skills, and diversify your mental health program and insurance coverage to make sure you're providing sufficient access, prevention, and treatment. So if we go to the next one, and actually deliver benefits equitably is our fifth and final finding. And from a global perspective, in my opinion, this is the most important finding because we have a long ways to go as a global industry in providing benefits that are truly equitable and inclusive. In much of the world, benefits vary by employee class. They don't meet the needs of vulnerable populations, women, LGBTQ+, ethnic minorities. High earners report having much better access to health and well-being benefits. The more senior you are in the organization, the more benefits you get. We all understand the role that perquisites play in total rewards packages. But when you think about health equity, you really need to start with health affordability. So, this is India specific data. The economic fallout of the pandemic has obviously aggravated the gap between low and high income earners. And the survey made it clear that the people who need support the most are the least likely to receive it. When you split the respondents into two groups based on household income, those at or below the median were significantly less likely to have access to each of the 16 health and well-being benefits we asked about versus those in the median. So again, some large spreads when it comes to access certain foundational benefits like medical coverage and life insurance. In India, a 9 and 5% spread for these benefits, respectively. So our message here, especially for organizations looking to lead on sustainability or ESG, is to flip the pyramid. Consider broadening access to certain benefits. This will become even more important into the future as flexibility take holds and we start to maybe see more part-time workers, more non-traditional workers. Nicole talked about, auditing the benefit plan eligibility requirements to make sure low-wage workers aren't excluded, consciously design programs to meet those health, risk protection, and well-being needs of disadvantaged groups. And I'm sure some of you are thinking, well, this is maybe partly a communications issue. So, review those communications with a diversity, equity, and inclusion lens to make sure that benefit messages are appropriately targeted. So before I turn it back to Namita, every single client I talk to, whether they're a local client or a global client, is revising their benefit strategy, questioning their guiding principles, putting together a 3-year roadmap, listening to employees to really understand their needs. I think our benefit modernization revolution is happening. I'm sure India will be at the forefront of it, leapfrogging. Those benefits that used to be delivered on site may not be as valued. Part-time working is going to have implications for benefits eligibility, new approaches to communicating benefits. So employee meetings and fairs to talk with benefits experts, just as well as how healthcare is delivered digitally. It all needs a rethink. And different health issues are going to emerge from remote working, ergonomic issues, unhealthy extension of the working day, social isolation. So these can all be solved, at least in part, in benefit design. And it's great working with the team in India to put those employee benefit, healthcare in particular, strategies together. Okay, so back to you, Namita.
Thank you so much, Amy, for great insights on mental health, LGBTQIs, and of course, Nicole, thank you so much for the digital care piece. And I completely agree with you, Amy, on One another thing which definitely has, the pandemic has brought in is the unified, approach towards health that we are seeing all across different geographies. So wonderful. So even before we talk about how will we adapt to the new benefit plans, I can already see that the poll question has come on screen and everyone has started responding to it. Wonderful. So the question is, as you plan to refresh your organization strategy for the benefits and or the organizational culture, what are the top 3 workforce needs, in your opinion, that are most critical to address? Wow, I can see that it's neck to neck with most of it. And undoubtedly, mental health is the main topic of discussion. And as Amy mentioned, even in our survey study, we do see that there is a lot of response coming in from employees as well for having mental health to be one of the key priorities when it goes ahead from a benefit restructuring or redefining perspective. So let's quickly go to the last section, wherein I will try and sort of summarize and say, where do we start and how do we go about redefining the benefits as we were talking about. And I'm sure by now all of you are sort of familiar with this slide, the 5 buckets that we had been talking about. So to quickly summarize, supporting your employees in the moments that matter definitely boosts resilience and drives commitment. So going forward, employers need a broader view of the moments that matter to individual employees. And employees thrive when they have access to a broad range of health and well-being choices. There comes again the flexibility part of it. While there are some benefits that most people want, the key call out that we have for you is there are other things which a small portion of employees would value intensely. So we need to be pretty mindful of the fact that it is not the majority that we really need to go in with. However, it should be a good blend or a mix of things that will be important even for that small population of employees, the moments or the benefits that's going to be of high value for them as well. Digital healthcare definitely enables employees to access healthcare support in a modern and a flexible way, providing additional support on preventing and self-managing conditions, because we did see in the section around digital healthcare wherein Nicole did call out that one of the top 3 items that came out when it comes to digital healthcare, teleconsultation, great, but employees are talking about solutions or teleconsultations where we can manage our conditions on our own or self-managing their health conditions, which is quite advisable. In certain conditions, I wouldn't say 100% dependency on managing their health conditions on their own. But however, from a primary care perspective, to some extent, providing support in that area would be very helpful. And utilization of digital health is definitely accelerating. You would have seen even in our Pulse survey study, which was very specifically done for India market, there has been a clear winner that teleconsultation or digital health is accelerating pretty much fast in India, with a vast majority of employees very keen to use this medium as well. In this report as well, you did see that over 80% of employees who took this survey did mention that they will continue to use the teleconsultation and the digital health modalities the employers are going to provide. I wouldn't talk too much around the investing in mental health, because all your responses in the poll question is a clear indicator that that's one of the top priorities for all of you. However, having said that, again, we need to start thinking broader in terms of mental health. Definitely from a regulatory perspective, as Amy mentioned, we are having, or we have seen a lot of positive moves in India market as well, with mental health care or the Mental Health Care Act coming into force and mental health being covered under your insurance policies. We do see a lot of corporates taking that path and going ahead and covering mental health. But when we say a broader outlook is required from a mental health perspective, Amy did touch upon things like, again, look at it from a no different from a physical health perspective, to have a primary preventive care along with your medical insurance piece, which typically covers the end of the spectrum, which is the right-hand side of your spectrum. But we have a good percentage of them sitting in the left-hand side of the spectrum that too needs to be taken care of. So definitely cover the complete spectrum, very, very similar to the physical health piece that we have. Employees want help to cover the cost of mental health treatment and tools to build resilience. And employees are facing emotional well-being challenges, financial worries, and feeling of isolation, which we touched upon in the earlier sections. They are just a couple of factors that have had a negative impact, but the issues and the opportunities that we have under this mental health is huge. So the next one, deliver benefits equitably. We did speak about it. Reimagine your benefit design from benefits for the average employees by creating solutions that will support all employees, be it low wage workers to women and LGBTQ plus individuals are amongst those in need of greater support. So this is in summary what we spoke about from an advantage perspective or the areas where you can support. So where do we start? We have tried to put in few basic things here. The report gives you the complete details of how we want to go about it or what could be the first step in that. So basically to redefine your benefits, first of all, first and foremost, take stock of what your people need now to identify the gaps in your existing benefits program. Definitely health on demand is a starting point for you because as Praval mentioned, this is an employee voice that we are bringing to you through this health on demand report. And these are achievable through customized employee surveys, focus groups, and current program review, which we continue to support, more than happy to support all the corporates in consulting with or conducting your surveys, focus groups, and the program review. Secondly, make the case for addressing the unmet need in terms of how this will drive engagement, productivity, and reduce costs. Plan and strategize to work on a business case to include not just the budget, but also to integrate your current provision to address the gaps, most of which we spoke about. And it is very important to drive engagement, and also to have a value on the investment that you're making. Sort of modernize your benefit plan design and promote inclusivity and sustainability using digital solutions from existing service partners or vendors, and also definitely look at innovative best-in-class providers. We spoke at length about increasing the breadth of benefits on offer by offering more personalization and lowering eligibility requirements. On the health and well-being front, definitely it is time, and exactly as Amy was mentioning, we continue to support our clients in reviewing your health and well-being strategy against the desired business outcome and then refine and enhance as is required. So by realigning your benefit programs to support what your workforce really needs, you can fill the gap to deliver results. And as we have discussed, it is imperative to sort of listen to the employees because they are not just telling you what they need, but they are actually also giving you the solution or the formula to win. So with that, I sort of hand it over to Praval for the closing notes. Over to you, Praval. Thank you so much.
Thank you so much, Dr. Nimita. Thanks, Amy. Thanks, Nicole, for sharing all the interesting perspective around the entire health on demand survey, how overall in the global and the India landscape, all these 5 things align so well. So it's a truly global outlook there and supported by the local country outlook also. I would like to stop here and quickly go into the Q&A session. But before I do that, a quick call out to all the participants here. We are at MMB ready to advise you and consult you in any area of healthcare consulting. We are there to support you through your journey on health and well-being. And we are ready to look through all your entire healthcare portfolio right now and advise you with the right solution, keeping in perspective the global and the local findings that we have always presented in our survey reports. So with this, I would like to open the lines. We have Nidhi Saxena who has raised the hand. Nidhi, would you like to come online and ask us the question? My colleague Niladri would unmute your line. And I invite Amy, Nicole, and Nimita to be on the panel and share their views. Yeah. Hi, Niladri, would you like to unmute?
Yeah, Nidhi, your line is unmuted. If you can unmute yourself and speak.
Don't have any response from Nidhi out there, but yeah, moving on from there, anybody else, we welcome questions. We have our global colleagues here, Amy and Nicole both. Any questions that you have around the global landscape or anything else you'd like to know from Dr. Nimita, who's a subject matter expert on healthcare risk consulting in India, we'll be happy to support you there. Okay, I think we don't have any questions on the tab, nor do we have any raised hands. So with this, I'd like to have a closer here for today's session. Thanks to all the participants for joining us today afternoon in this insightful discussion. Thanks, Amy. Thanks, Nicole, and thanks, Dr. Nimita, for being around with us. See you soon again. Thank you. Bye-bye.
Thank you so much, everyone.